Hello, I'm Myra Rivera, Community Relations Manager at Legacy Community Health. Today I'm talking to Dr. Amelia Averyt, Associate Medical Director of Family Medicine at Legacy, about keeping your kids healthy during the colder fall and winter months, especially during the COVID-19 pandemic. Welcome.
I'm very excited to talk about these important topics.
And Dr. Averyt, can you tell us why do children seem to get sick more often during the winter?
Typically, illnesses like the cold and flu occur more frequently during the winter months, but unfortunately, the reasons are not always straightforward. Cold temperatures do not cause illnesses, but when it's colder outside, children tend to spend more time indoors together, and it's easier to share all those germs and infections among them. Some viruses also thrive and spread in cooler, less humid air, like that we have during the winter. Nasal mucus can also be drier and stickier during the winter months, which can also help out some of those viruses.
And what are some of the most common illnesses that afflict children during the cooler weather months?
One of the most important ones that we encounter is called respiratory syncytial virus, or RSV. It's a common viral respiratory infection that, in children younger than 2 years of age, causes a condition called bronchiolitis, which is a lot of inflammation in the tiniest parts of the lungs. RSV can be serious in infants and can cause serious breathing issues in these kiddos. Another virus we commonly see in winter months is the influenza or flu virus. It can be minimized if your kid gets immunized, so important to get that flu vaccine this year. The symptoms of the flu include fever, cough, and body aches, and can last up to 7 to 10 days. The common cold is more common in winter, but your child can catch a cold any time of year. Strep throat is another infection caused by the highly contagious streptococcal bacteria. It can spread through coughing, sneezing, or sharing food, drinks, utensils, other things like that. It most often occurs in kiddos between the age of 5 and 15 years old. Symptoms include trouble swallowing, swollen tonsils, or swollen lymph nodes. This is the only infection that we've discussed so far that would require antibiotics to treat.
With COVID to worry about this fall and winter, should parents do anything differently than last year to keep kids healthy?
So with COVID and flu circulating, plus the normal slew of all those other common colds, doctors and parents will need to work closely together to keep kids healthy. Because of COVID, it is even more important that parents vaccinate their children and themselves against the flu. The impact of the flu can be minimized. It can help doctors better focus on identifying and isolating COVID-19 cases. It is also important to keep sick kids or kids who have been exposed to COVID home from school and other activities. Often, parents don't worry about sending their child to school with minor cold symptoms. This year, it's super important to keep them home. The way to minimize spread of all these respiratory viruses are those simple personal protective measures, like covering your mouth with a mask when you're out in public, washing your hands frequently, and like we discussed already, staying home when you're sick.
What can parents do to keep their children healthy this time of year?
Number one, it's time to get your yearly flu shot. It's also important to teach those good hand washing techniques. Sing happy birthday or twinkle twinkle little star while washing those hands with soap and water. Minimize or avoid infections by reducing the exposure of your newborns or younger infants to other people until they're at least a year old. Encourage your kids to avoid people who are obviously sick, hacking, coughing, sneezing with a cold or the flu. And teach your kids that important cough etiquette, which means turning their heads and coughing or sneezing into a disposable tissue or the inside of their elbow if they don't have a tissue readily available. This can help reduce the spread of germs onto everything they touch.
How can Legacy help keep my family healthy during the traditional cold and flu and now COVID season?
If you find your child showing any signs of any of the conditions we've discussed today, reach out to your Legacy pediatrician or other provider for assistance to schedule an appointment. We are here to help keep you and your family healthy during the active cold and flu season as well as during this COVID-19 pandemic. You can call 832-548-5000 to schedule an appointment.
Thank you so much for joining us today.
Thank you for having me, and y'all stay safe.